My name is Ken Riley. I'm the Director of Patient and Population Health Technologies for Baystate Health. We are an integrated delivery network in Western Massachusetts. We have about 1,000 beds, 3 community hospitals, and serve a population of about 900,000 patients. There's 3 topics that I'd like to talk about today. One is the patient portal built on InterSystems Personal Community. The second is our COVID vaccination clinic that we stood up. It is definitely something that represents hybrid care and an excellent example of the challenges that patient technologies can address. And the third topic is just the future and some of the things that I see on the horizon. So let's talk about the patient portal. Patient portal was completely redesigned 1 year ago. It was designed with our patients. We partnered with our patient and family advisory committees. We partnered with our various business units at Baystate Health in order to create a unique experience for the patients in our region. One of the things that we are proud about is the usage of the patient portal. So over this past year, we've more than doubled the amount of patients on the portal. If you look at the utilization data of those patients, you'll see that we have almost an 80% utilization rate. So we've got over 100,000 patients on the portal to date. And of those 100,000 patients, we've got almost 80,000 of them that are dialing in over the period of a month, 2 months, certainly within the span of this particular year, to engage with the health system. They're using the portal to have messaging with their providers. They're using the portal to request pharmacy prescriptions. They're using the portal to request appointments. They're using the portal to learn about the COVID virus. They're using the portal for much more than just going in and looking at, say, their lab results. Now, we all know that patients in the center of care is a mantra that we've been chanting for many, many moons at this point, but we haven't really put them in the center. And by that, I mean allowing them to tag specific types of data, allowing them to approve and or, God forbid, disapprove some of the plans of care that have been provided for them. We partnered with the Substance Abuse and Mental Health Administration, SAMHSA, to take one of their open source products called Consent to Share, built it into our Health Information Exchange, built on the HealthShare Foundation, and now we'll be pushing it forward to the portal such that patients can approve and or disapprove that particular care plan. The second topic that I wanted to address, like I said, was the COVID vaccine clinic. Boy, what a challenging setup that was. So you had the whole continuum of patients as old as 90 plus, all the way down to 16 years old. Patients that embrace technology, patients that abhor it. We needed to be able to address all aspects of care. It wasn't good enough that we created a website for patients to be able to get to their vaccine appointments or supply an app, because we recognize that there's major components of the population that perhaps don't have an internet connection, maybe don't have a smartphone, perhaps only make appointment requests through a telephone, through a landline. Maybe they only have ever done it face-to-face and they've never even used services that have been offered by health systems for those types of things. So the vaccine clinic required us to pull together a stack of patient technologies to be nimble enough to provide the services that our patients needed in order to be a part of the vaccine rollout. One of the aspects of the vaccine clinic that truly helped was the creation of our dashboards. Now, the dashboards surfaced data and trends to our clinicians and our clinical leads and our executive leads so that they could see how the rollout was progressing. In closing, I wanted to talk a little bit about the future, and that's the part that excites me the most. Social analytics is another data set that's very much becoming more paramount in our ability to provide prescribed services to our patients, to be able to know our patients. When you start coupling all this information together in applications like HealthShare and partner with companies like Data Robots, you can create predictive models that truly enable us to provide the experience that we've been talking about for a long time. Things that Amazon, the Googles of the world have already achieved, but the health systems are on the cusp of achieving. And finally, the one that really gets me excited is this notion of virtual waiting rooms. Again, You can take virtual waiting rooms as far as you want, right? There are things like the Oculus where you have an immersive experience. Or a virtual waiting room could simply mean that you're in a database and you're on a list, and that list has some sort of algorithm applied to it such that when the appropriate variables have been hit, your age, your occupation, whatever the stipulations were, say in the case of the COVID vaccine clinic, to have an automated outreach go to you, much like you were in a waiting room waiting for your next turn in service. But being able to provide value while someone is in a virtual waiting room is hugely important. Thank you very much for your time. I appreciate it. Please feel free to reach out. I enjoy this topic. Enjoy the rest of your day.